Hello, my name is Dr. Corey Richardson. I'm the CEO and Clinical Director of ICGH, providing integrated care across North Carolina. And today we're going to do an overview, if you will, of the strategic engagement we had in Carteret County, where we took a 1953 general hospital, 110-bed general hospital in Sea Level, North Carolina on the coast, and repurposed it for behavioral health services. This is a beautiful picture of from the back of the facility, as well as one from the front of the facility. And you can see it's really a pristine area, very serene for offering detox and crisis management, as well as residential services. This is an overview of an integrated approach to care. Foundationally, we look at behavioral health interventions that are evidence-based, and then we incorporate psychiatric care, social interventions, such as literacy and supportive employment, lived experience in the form of peer support specialists, as well as counselors and therapists with lived experience. But we also incorporate MAT, medication-assisted treatment for opioid use disorder, treatment for comorbidities, such as anxiety and depression, including trauma-focused CBT, physical medicine for those who we engage, allowing them a bridge to getting to a PCP. Very often people are coming to the program and they've not addressed a lot of physical medicine due to psychiatric or addiction needs that they have. Resource navigation as they leave inpatient settings, and then incorporate outpatient and transitional housing, and of course recovery housing, which has been really fundamental for a lot of the work that we do, giving people a safe, supportive environment that's drug-free while they continue treatment. This is a Venn diagram slide that I did for Governor Cooper back in 2018 on his opioid panel. And I think it does a pretty good job of outlining how we do treatment planning using a biopsychosocial spiritual model. And when I say spiritual, we're not a faith-based organization, but we do incorporate meaning and purpose when it comes to treatment planning. So on the medical side, as I just mentioned, medication-assisted treatment, also known as MOUD, medication for opioid use disorder, treatment for co-occurring, but incorporating pharmacology, laboratory. On the psychology side, evidence-based counseling, including trauma-focused CBT for trauma, behavioral interventions for co-occurring disorders, and recovery-oriented. And we do fundamentally use, for addiction treatment, a 12-step facilitation model. Social interventions are going to be including AA&A, education, supportive housing, supportive employment, and transportation. And then, of course, incorporating all ASAM levels of care from detox and early intervention. From detox all the way down to early intervention. These are the number of providers that are essential to providing an integrated model of care, from licensed clinical addiction specialists, specialized training around for our PAs and doctors, our nurse managers, as well as having our own pharmacist. These are services that we provide for adults as an outpatient program across North Carolina, including EMDR, gender-specific groups, recovery housing. We currently have now 100 beds of recovery housing across North Carolina for men and women. RAP training, co-occurring disorders, and of course for children and adolescents, we're really proud of trauma-focused CBT being provided, comprehensive clinical assessments, as well as in-school services. We have always offered specialized programs, even back in 2012 and 2013, when a lot of programs were not providing MAT to expectant mothers. A lot of times we're engaging women who are identified as having an OUD, and at this point, getting them on MAT is the safest way to bring that delivery to full term safely. And a lot of my early referrals were from hospitals that were not comfortable providing MAT and counseling. Now I think a lot of that has changed. We do have our own pharmacy so that it increases the retention in the program, confidentiality, especially in small communities where there's a lot of stigma around MAT, and then also addressing any costs that might be a barrier to care. Our clinic-based pharmacy services are also essential for our mobile medical units that go out to rural and remote areas in North Carolina. A quick overview of provider education that we provide in every catchment that we're in, whether that's a county grant, a county contract, a federal grant, or even just one of our community partners. And of course, research is essential in North Carolina and across the country to support evidence-based models of care and create new models. And so this has been a big part of my program as well. I'm very excited about working with organizations like North Carolina Physicians Health Program for the first ever primary research provided with PAs and a state monitoring program. Churches, civic organizations, and coalitions really being a community partner is essential, not only to providing the best care, breaking down silos, but also addressing stigma. And so that's been a big part of our program for a long time, as well as community awareness across North Carolina, including our large recovery summits like the ones we have in Gastonia. But across North Carolina, really trying to be part of the community. We have several large anti-stigma campaigns over the last 10 years through our rural billboards addressing a lot of stigma around addiction, as well as some of our TV appearances and even some of our PSA TV ads in North Carolina, really just trying to break down stigma and encouraging people who are struggling from addiction to seek help, especially with federal funds providing a lot of free help. Um, More of the same. Harm reduction and prevention programs are essential, and a lot of times there are a lot of real negative connotations around harm reduction. But we just want to say that there's a lot of harm reduction in our community today, and essentially helmets, seatbelts, filters on cigarettes, stuff like that, things that are known to harm, but reducing that, and people that are 10 times more likely to enter treatment if they are provided some harm reduction. So our vending machines, our pill take backs, our safe to call campaign, and other types of harm reduction models have been essential to addressing the opioid crisis, as well as just ravaged communities from drugs. Emergency medical and hospitals, really having a warm handoff between EMS and EDs in North Carolina. We have a great program with Atrium Health from the EDs, and in all of our different communities, really getting quick referrals from the emergency departments, especially when it comes to quick admissions into our detox and crisis management program in Carteret County in our new inpatient facility. But for post-overdose response teams, EMS programs that are going out and providing rescue Narcan and being able to put somebody quickly onto the MAT schedule and get them counseling, I think has made us an amazing partner in the communities that we serve. Law enforcement assisted diversion, recovery courts, including Veterans Court, adult and adolescent jail treatment services, providing peer support as well as treatment services inside of jails. We're in a number of recovery courts. We do participate with LEAD in Catawba County and Gaston County. And then inside the jail, I know that for adolescent services, Alexander County, as well as for adults in Cleveland County, and also participating now in Pamlico County. There are a lot of other counties I'm sure I'm missing when it comes to these three really great programs for justice involved individuals, but partnering with law enforcement is a big part of our program. So much so that when there was a deadly shooting in a homeless encampment in Gastonia, um, the Gaston Police Department immediately reached out to us to be there on Monday morning at 7 a.m. to help place people in recovery housing or detox. So that's exactly what we did. You see some of our team, as it was written up in the Gaston Gazette, being able to provide immediate resources in a real crisis situation for one of our urban partners. Being a partner with government, as I mentioned, partnering with both sides of the aisle, whether it's Patrick McHenry, our former or current governor, Tom Tillis, and others. Uh, Really, it's important for our legislature to know what works, what doesn't work, what our lawmakers need to support, and then laws to really prevent predatory providers from still doing what they do. But very proud of the work we do with government. Um, and I think it's been essential part of our federal grants as well is incorporating our government partners. Some innovative programs that really anchored with our peer support. So one of our peer support specialists, an amazing woman, has a program that she's developed with me for direct services with DSS. So working with DSS workers when they're working with moms with addiction or dads with addiction. Also, some innovative programs like equity navigation and other resource navigation programs, and then being able to go back to DC during conferences and present this on a national level uh, so that others can replicate this in other states across the country. Here's a number of our federal grants, and we were able to bring a brand new federal grant to Carteret, Craven, Pamlico, and Jones counties um, right after we secured the lease. It's a 40-year lease here at $1 a month in Carteret County for the facility here. We were able to secure a 4-year, $3 million news release actually for another one of our federal grants. And to be honest with you, I think we're in about 5 or 6 different federal grants right now. These are the grants that support a lot of our work that wouldn't go on otherwise, such as outreach to the unsheltered, engaging with them where they are, but then bringing them directly into recovery housing, and then offering them free treatment services and leveraging what's available, especially now that we have Medicaid expansion. Our very first day one recovery apartment building, and like I said earlier, we have really a network of payers when it comes to recovery housing, but from primarily federal funding, but also includes HUD and some county grants as well, and state opioid response dollars. But being able to provide those who were previously unsheltered, living in encampments, recovery housing with treatment and peer support has been essential to turning people's lives around. More around our rural and urban resource navigation programs, which we call resource navigation contracts. These are county contracts usually, but they're incorporated with all of our programs. And our mobile medical units, just to give you an overview of those rural and remote areas, whether it's outreach to the unsheltered or whether it's direct medical care, which we're able to provide anywhere in North Carolina. Let's talk a little bit about ASAM levels of care. And now with our inpatient services at 3.7, when it comes to detox, or 3.5 residential, we're able to provide every level of care except for hospital, inpatient, intensive services. As I mentioned earlier, Carteret County found out about a lot of what we're doing, and there was a huge project, which is a 110-bed general hospital right here on the coast, up in sea level, right before you get to the ferry to go to the Outer Banks. There was a press release, of course, around us taking over the facility, and we quickly opened up inpatient services across the catchment area, providing federally funded services and also incorporating opioid settlement dollars to provide free recovery housing and free MAT. Our peer support specialists and the outreach work that they do across the catchment area has been amazing, as well as managing recovery housing. And we have, I think, 4 or 5 peer support specialists that work in this catchment. Here's one of our other outreach events, which we're always a community partner and very excited about being able to partner on the community level. Partnering with large coalitions, especially RAI, and one of their annual summit, I was able to present a lot of our work across North Carolina. So great to be a sponsor of such an amazing event, amazing organization, and then also participating. And of course, our $3 million grant that we brought immediately to the coastal plains and waterways. And just excited about being able to bring some federal funds, much needed as we create sustainable programs. Incorporating whole person care, expanded services and access, workforce development, and of course, data-driven outcomes. You can talk more about that if you want to reach out to me directly. One interesting, innovative program that we were able to present to DC was addressing gaps in care, so using some federal dollars and incorporating what's crisis management and detox. Sometimes clients are coming into crisis management and detox. They've got complex medical or complex psychiatric needs, and once they're stabilized, there's a real limited time that they can remain inpatient before they have to be exited, just because of the limits on payer criteria. And what we were able to do was really support safe transitions into long-term housing at the appropriate level. So some of this might be persons that presented with IV drug use, and then after stabilization in a detox setting, it was found out that they had undiagnosed psychiatric, and we were able to get a psychiatric eval, stabilization of management, and then sometimes it takes quite a while to get them placed in the right psychiatric facility, and so, or even a nursing home. And so being able to use some federal funds to do this work is really, I think, an innovative way to use some federal grants as we learn to navigate these waters, and then get a better idea of community partners that can help us when it comes to placement across North Carolina. This is a news release about the renovation of the Sea Level facility, and that's our central nursing area of our 3 wings for adult services. And currently we have 54 beds of adult services open at sea level after a year of extensive renovations. 16-bed facility-based crisis, 20-bed detox only services, and 18-bed substance use disorder residential treatment. Here are the services that we're currently provided, and in the catchment area, and then in inpatient adolescent mental health, as well as adolescent facility-based crisis, we plan on opening here at the hospital next year. So that'll add 16 beds of crisis management and 12 beds of mental health for kids. Again, these are some pictures of our facility and the seamless levels of care between inpatient and outpatient care, including recovery housing. Just some of our newer billboards that are starting to replace some of our other ones that we had recently around free outpatient care. Just really excited about the program, of course, and being able to see it come all the way around from a facility that needed a lot of renovations to now fully licensed, up and going, meeting a real need, not just for Carteret County, but regionally, being able to medication administration technicians, nurses, behavioral health techs, kitchen and sanitation staff, administrative staff, just a lot to the community as well. This is our family of companies and our contact information here. So this is a final picture from the hospital, a really pretty view that we look at every night from the Nelson Bay. And just thank you for your time, as well as if you have time to look at our other services talk to give it more of an overview of what we do on an outpatient basis. but wanted to give you a little bit of an understanding of how we took a general hospital and with real buy-in from the community, we're able to renovate it completely and now provide some needed anchor services when it comes to inpatient care around crisis, detox, and residential.